Good afternoon and welcome, ladies and gentlemen. We are convening the Health Subcommittee of the House for Tuesday, February 28th, the year 2023. It is 1:30 p.m. Ms. Adams, if you could please call the roll.
Representative Hicks.
Here.
Representative Jernigan. Representative Leatherwood.
Here.
Representative Martin.
Here.
Representative Mitchell.
Here.
Representative Sherrill.
Here.
Representative Terry.
Here.
Representative Williams.
Here.
Chairman Hawk.
I am here.
You have a quorum.
We have a quorum. Perfect attendance. Thank you all very much. You all just passed your perfect attendance grade today, so congratulations. As we're beginning, looks like we've got a lot of visitors in the audience. Thank you and welcome. Glad to have you here. Do we have any personal orders of any committee members? Chairman Jernigan, you are recognized for a personal order.
As soon as I get myself situated here, get my stuff up. Okay, thank you, Chairman. I'd like to recognize a few folks that are sitting in the audience today. You'll see them in the red shirts, but Tennessee Families for Vaccines is a volunteer-driven group of parents, grandparents, pediatricians, providers, teachers, and nurses, and families dedicated to preaching the importance of routine vaccines. And this represents their launch their organization. This is their first day on the Hill, and I just want to welcome them. And please stand up and say hello and welcome them, please.
Welcome. We are glad to see you. Anyone else have any personal orders? Chairman Terry, you're recognized.
Thank you. I've been told it's Pharmacist Day on the Hill, and if we can recognize them. Thank you.
All right, again, thank you. Welcome. We may stall for a bit more time as Speaker Marsh is trying to make it to the room. Anyone else have any personal orders?
He's there.
I stand corrected, front and ready to go the whole time. Ladies, we do have a calendar, and Speaker Marsh, you are recognized on House Bill 803, and you have your motion and your second. You're recognized.
Thank you, Mr. Chairman. This bill concerns certified medical assistants. 2 years ago, the House of Representatives passed legislation that created a scope of practice for certified medical assistants working in the outpatient clinics. That legislation allowed them to perform several tasks believed to be within their ability and training. Since then, a group of hospital outpatient clinics have identified several other tasks that they believe that would be appropriate. The proposed additional duties would permit a medical assistant to give vaccines from multi-dose packaging, to give rectal medications, to prepare medications to be given by the provider, clarifies that medical assistants cannot give medications or vaccinations that require dosage calculations. We believe that this will build on the success that we did a couple of years ago while maintaining the quality of care and patient safety. With that, I'll answer any questions.
Thank you, Speaker Marsh. Any questions of the sponsor? Seeing none, are you ready to vote? All those in favor of sending House Bill 803 to full Health Committee, please signify by saying aye. Any opposed, please say no. The ayes have it.
Thank
Your
you
bill
very
goes
much.
forward.
Thank you.
Thank you, Speaker Marsh. We're now ready for item number 2 on the calendar. And I think I saw, yes, Chair Lady Hazelwood. Chair Lady Hazelwood, you are recognized on House Bill 792. We have a motion. We have a second. You're recognized.
Thank you, Mr. Chairman. This bill came out of a long conversation over the past few months about how we in Tennessee are going to push, promote, and support pro-life agenda. Other members of our General Assembly, Senator Hale led the charge on the Senate side. We had extensive conversations about how we can improve adoption, foster care, and support families in Tennessee in general. This bill is a part of that adoption package that I hope most of you have heard about by now. We have really decided that in Tennessee, we're going to put our money where our mouth is, and we're going to prioritize children and families, and we're going to support those children and families. And we're trying to develop ideas about how to do this. There's a whole plethora of great ideas, ways that things that can be funded that would assist families. Child care, there's a child care task force that I served on that looked into that issue. Food security, clothing and supplies, all sorts of things. And as we all know, there are literally tons of not-for-profits in Tennessee doing a great job helping provide a number of these things. And what we don't want to do, I think, as a governmental entity, we never want to usurp the private sector. We don't want to make a nonprofit or a family any more dependent on government assistance. That's not what we're about. But we do want to support them and make it feasible for them to be self-supporting. And when we're looking at all these nonprofits, it's hard for us to determine who should be a winner, who should be a loser, where should we put those dollars. So, the problem is right now it's not so much a problem of money, although when we get into finance, I won't tell you that. It's always a problem of money.
Understood.
But we do have dollars available at this point in time, but the problem comes with how we're going to use those dollars and make sure that we use them most effectively. And we've done some things in the past that have worked well in Tennessee, and we thought that we could use that as a model. So rather than trying to specify every not-for-profit or having every nonprofit come up here and try and make their case to the General Assembly and get support in a budget amendment and that kind of thing, that we could go one better, and we could set up a trust fund like we've done for mental health and the opioid abatement trust fund. This trust fund is empty until and unless the General Assembly appropriates money into it. But if we choose to do that, then the endowment, the income from that trust fund, will be used to support these nonprofits, and there will be a process, a grant process, so that we can make sure that we're choosing those who have most effective outcomes. So with that, this bill simply would set up that trust fund and allow us to have a methodology for getting funding from the state out there where it can be most useful. And again, as I said in the beginning, I'll say in the end, what we're attempting to do with this is to support life in Tennessee, to support families. So with that, Mr. Chairman, I stand ready for any questions.
Thank you, Chair Lady Hazelwood. Any questions or comments for the sponsor? Representative Williams, Chairman Williams, you're recognized.
Thank you, Chair Lady, for this. I think it's really important. Anytime we can fund these long-term efforts with a fund like this would be great, and your advocacy on behalf of children and families across the state is very important. So thank you for bringing this bill.
Thank you. Chairman Terry, you're recognized.
Thank you. And to me, the way I looked at this was similar to, and you know this quite well, with dealing with TANF and the Child Care Development Fund. Of course, with those, it's not as efficient, and there are strings attached to it. And this is a way that I think that we could set something up and more effectively and quickly get help to those individuals. So I appreciate you bringing this.
Thank you. Questions, comments? Charlie, I will say the funding mechanism and much more discussion when we get the bill to finance, but is there a thought to potentially create some a distribution to the fund in the current budget we're discussing, or is this future years down the road, or where do you envision that, Chair Lady?
This bill establishes the fund. I think it would be up to the will of the legislature as to, it'd be nice to put some nice even numbered amount of money into the fund, but if we wanted to add some funding for, first year, if we could extrapolate what we would expect to get on an annual basis going forward and maybe look at it that way. But again, I think that's for discussion as we get into the financial aspects.
Perfect. Thank you very much. Are you ready to vote? All those in favor of sending House Bill 792 to full Health Committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you.
Thank you, Chair Lady. We are now ready with impeccable timing. Chairman of Commerce, item number 3 on your calendar, House Bill 1051. Chairman Vaughn, you are recognized. We have a motion and we have a second. You're recognized, sir.
Thank you, Mr. Chairman. I appreciate that. Folks, I am here to discuss and offer House Bill 1051 for your consideration. I believe we have an amendment.
Yes,
as
sir,
well,
we
Mr.
do. We have amendment drafting code 4484. Should be in your packets. We have a motion We have a second. We're going to go ahead and get the amendment on the bill, and we'll discuss it in its posture when we get there. All those in favor of placing amendment coded 4484 on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. The amendment is on the bill. You are recognized, sir.
Thank you, Mr. Chairman. House Bill 1051 is a continuation play from last year. We were attempting to make some changes which were dealing with staffing issues as well as the type of care that patients deserved whenever they were struggling in some of their greatest time of need from a psychiatric standpoint. After last year's failure to advance the bill, the Tennessee Psychiatric Association, the Tennessee Medical Association, along with the Tennessee Hospital Association, and then they also sat down with mental health and substance abuse to come up and draft the language that you see in front of you today. What this amended bill will do is it allows a physician to complete and sign either the first or the second certificate of need for involuntary admission for an inpatient psychiatric hospitalization. The current state law allows qualified mental health professionals, including psychiatric advanced practice nurses and PAs, to serve as the first two required signatures on a certificate of need. And this is a little bit different certificate of need. We hear of that with regards to health facilities all the time. This is the same term used in the involuntary commitment for psychiatric treatment. Serves the first two required signatures, and that's for an involuntary emergency admission to psychiatric hospital. The bill also states that if the first signature is completed by a physician, then a qualified advanced practice nurse or PA can complete the second certificate of need for emergency admission and treatment. Now then, that was along the lines of what we've been seeking. In addition, what this bill proposes in the second and fifth section is that it allows a single admitting psychiatric hospital to accept one CON from a board-certified licensed psychiatrist, except with the following exceptions. The 4 regional mental health institutes or the mental health department's contracted hospitals, it does not apply there. As well as it prohibits the use of a single certificate of need for admission if it's completed by a psychiatrist with a familial or legal relationship to the patient, which means you cannot commit your mother-in-law with a single signature. Or I don't know why, just brother either. Let's throw brother in there as well. An ownership.
I think I hear that this committee may be ready to vote, Chairman. So.
An ownership interest in the admitting facility or one that is employed by our contracts with the admitting facility. So they don't want it to be a measure by which a psychiatrist uses it to provide any type of areas of practice that are perhaps could be emotional to that person or financially lucrative for that person. So that's why those exceptions exist there. So anyway, that's what we've got before you today, and appreciate. I've also got some expert testimony if questions are needed beyond my capabilities.
Thank you for sharing your capabilities with
Thank you,
us,
sir.
Chairman Vaughn. Any questions or comments for the sponsor? Chairman Jernigan, begrudgingly, Chairman Jernigan, you're recognized.
Okay, thank you, Chairman, and I've discussed issues with you on this, and I certainly understand that Section 1. I love it's great. We need it. The Section 2, I'm struggling with. I understand. It's just having one person decide. I'm more of a that the first officer needs to agree with the captain before they fire a shot, to have 2 eyes on something. So if I have a certificate that's issued, and if you can walk me through this process, that if one person, one psychiatrist, and I can't tell you if it's a misdiagnosis, if they've had a bad day, I don't know what it is, but they start the admission process. It's the admission process that I don't know a lot about. I can tell that we're going to go out of session here, or okay. And so I would ultimately, before we take someone's rights away with starting an admission, that two people be involved instead of one. It's a trust and verify, or it's backing up. So I'd heard that if they're admitted and they go to a facility, that the facility can't hold them there if they're not having symptoms. But somebody at that facility has got to be a second pair of eyes, and I don't know who that is. I don't know if anyone knows who that is. If I'm being held somewhere, and that facility it's the admin, or it's a nurse, or it's a I don't know who it is that's saying yes, they need to stay, or the period of time that's going to be for that person that's going to be there. If it's going to be 24 hours, is it going to be 3 days? There's a lot about the process I don't know. What I'm not really comfortable with is one person making the decision to take someone's rights away, where they have to take medication. They have to do the orders of whoever's providing it during that small process. Am I off on that? Or I'll just leave it at that. We can start a discussion.
Chairman Vaughn, you're recognized.
Thank you, Chairman. And Chairman Jernigan, we have similar concerns. What we're talking about is dealing with somebody who, are they just having a really, really bad day, or is it some form of psychosis that they're having a break from reality and they're a danger to themselves and others? That's, whenever we consider how they're treated, people deserve to have expert capabilities used to assess those people at that point in time. What this bill contemplates is that it's relying a lot on the abilities of the board-certified psychiatrist in that instance, because what we don't want to run into is the opposite. What generated this bill in the first place was the need for staffing, the need for appropriate staffing to deal with people in the manner in which they deserve to be treated during a really, really stressful, terrible time. What we're saying is, though, is in the event, and hopefully it's a rare event, that the person, if we're struggling with manpower, there's an issue, the fact that one person who is the person that's committing them is doing so is a board-certified licensed psychiatrist. It's someone who has the highest level of training of any other individuals that we're contemplating in this package. Hopefully we don't ever see those. But to me, that seems more of a stopgap, is if we have somebody, and where are we going to find the secondary person? I was seeking counsel on how long could somebody be kept, and that was 72 hours with 72 hours. Sorry, sir. This is a very intimate setting here, by the way. I just feel like I ought to up there and throw my arm across the thing, talk to y'all. The 72 hours with court order is how long they can be kept.
Okay.
Chairman Jernigan.
Well, okay. I guess I would start with board-certified psychiatrists. There's always that psychiatrist who graduated last in their class. So I'm not sure that that's why we need always go to a doctor. Something that's a diagnosis, you get a second opinion. And I think that's what we're trying to get at. So 72 hours, what happens in the first 2 days that they're being held with no rights? And where's the second, what happens the first 2 days, before the 72 hours?
Mr. Chairman, I think we're getting quickly into water that is over my head, so if we could, sir, go out of session, and I have representatives here who can answer those questions and probably many, many more.
Certainly. Thank you very much. And for the record, I'll note that the psychiatrist who finished last in their class is still smarter than me. So I think we have Zach Blair on the list.
We do indeed.
At this moment, we will go out of session. Mr. Blair, if you could please find the microphone there, turn it on, and tell us who you are and who you represent on this particular issue. Please, sir, you're recognized.
Thank you, Mr. Chairman. Zach Blair with Tennessee Hospital Association. Thanks for having me, Chairman Bond. Thank you for your explanation. Chairman Jernigan, I know we've been able to discuss some of these issues, and I think the thing that gives me the most comfort when talking about this is when someone gets to a hospital, specifically a psychiatric hospital, they are evaluated and treated immediately when they are admitted. So they are constantly going through the process of determining whether or not someone continues to meet legal criteria to continue to be held involuntarily on an emergency basis. That would include the people that admit that patient right when they walk in the door. That would include the rounds that those physicians and treatment team take during the day. There's also a provision of the amendment that if they believe that that person no longer meets criteria, either when they get to the facility or later on in their stay at the facility, that certificate of need can be rescinded to begin the discharge process in that circumstance. We believe there are appropriate and robust guardrails in here. I will say that, yes, there are multiple professionals that are still indicating that this person has met criteria to still be there. It just may not be on a sheet of paper like we have traditionally done it in every circumstance. But I will say this is a very, very limited provision that likely hasn't and doesn't happen regularly or even often. And there are significant guardrails in the bill to prevent those conflicts or someone who potentially may try to abuse the system because, again, those facilities can no longer hold that individual once they are no longer in that crisis and deemed to be a danger to themselves or others.
Chairman Jernigan, you recognize.
So I think that what you said that kind of puts me there. You said it's not written on paper. So I don't know if I'm being admitted somewhere in Scott County and I'm there. I don't know who's qualified to. I don't know who's doing what. It could be just the admin person. It could. I need a certain set of eyes that's under Title 63 that can tell me that yes, you definitely need to be here. And again, and I'll follow up what I asked the chairman. What happens between those 72 hours? What the second day? You know, they're still there under one person's authority and certificate. That they'll be forced to take the medication. They'll be forced to do whatever they're supposed to do, and I still don't have a second person. Now I don't know who the facility that you're talking about. You don't know. It's not on paper. You're just trusting whoever's there. I worry about that person who can get caught in this trap in those first 3 days with only one person diagnosing without a second pair of eyes.
Mr. Blair, you recognized.
Thank you, Chairman Hawk. Representative Jernigan, completely understand those concerns. The people that are going through this process are going to a psychiatric hospital. That's the only place that they can go. And at those psychiatric hospitals, you have professionals that are specifically trained, licensed, and deal with these particular patients every single day, 24 hours a day, 7 days a week. So while it may not be on the certificate of need piece of paper, it will continue to be documented in their medical record, their evaluations, their treatment will continue to happen, even during that short time that they may be there between the order being issued, a potential probable cause hearing. But regularly people are discharged before you ever get into the court interaction process because they stabilize quickly and no longer meet those legal criteria and can be discharged immediately from the hospital.
Recognize Chairman Jernigan.
Well, you were talking about staff shortages. And now here I am. What if there's a staff shortage? I don't see, if we talk about a psychiatric hospital, what you're talking about, there should be somebody there that can do the second certificate. That can verify what the first one said of the psychiatrist. Sure. That's kind of what I'm getting at on this, because man, I love Section 1. We need it. That's the staff shortages. I'm all about that. I like the guardrails that are put in number 2. I don't like one person playing God over somebody's rights, at least in this country, about what they can take away. And in this 3-day to 72-hour period before that, there's this big gray area that someone in some facility somewhere, which I don't know who it's going to be because you're not requiring a certificate, that's going to make the determination of what this individual, and it may be rare, but it's still, they've got rights, and they need, if we're going to take it away, we need more than one person. So those are all my comments for Mr. Blair, and thank you for stepping up and clarifying some of the stuff.
In response, Mr. Blair.
Chairman Hawk, thank you so much. I will say that a person would not be transferred to that psychiatric hospital unless that hospital has indicated they can and have availability to treat that patient. That's part of the transfer process of moving someone who has gotten that initial evaluation and certificate to the second. I completely agree, Chairman Jernigan. There are people there that can complete a second certificate, and this bill still allows it. This is a permissive section that a facility may admit without a second certificate and doing that formal documented paperwork evaluation on the front end, but they can still require that if they choose to, and they can continue and still have the obligation to release that person if that person no longer meets that legal criteria to be held there in an emergency basis.
I was done, but now I'm not.
Chairman Jernigan, you're recognized.
So you say that there's somebody there. You don't know that, and I don't know that because it's not on the paper. It could be staff shortages, like you said before. I don't know that someone's there within that 72 hours. And we're holding somebody. That's a problem. Unless you have a second pair of eyes that comes in and says, yes, this is truly what it is. You know, it's too much faith in one person, and that's just kind of where I'm at. If you want to talk again, we can keep going, but that's enough for me. All right, thanks.
Chairman Terry, you're recognized.
Thank you. And a couple questions. You did allude to something there about staff and having people there that can see this, but I guess the question is, what is the timeline on the CON? Like, say the psychiatrist executes it, and you said that they would be transferred and there is a bed for them. Can they execute a certificate of need if there is no facility with a bed? How does that work?
Mr. Blair, you're recognized.
Yes, sir. And this typically happens in a hospital setting, which is really what we are looking at accomplishing with the bill. Folks may present to an emergency room, a certificate is issued, and yes, they have to wait for a bed to be available before that patient can be transported by a sheriff's office or another private party that the county contracts with to that receiving hospital, and there has to be a bed available before that transfer happens. So those patients aren't transferred unless there is availability to the hospital that they are being admitted to, potentially once they are received by that psychiatric hospital and still meet criteria at the time they hit the door.
Chairman Terry.
So how long could they sit in one hospital, have a certificate of need, and then, I mean, could they go a few days before there's a bed available at another at a psychiatric hospital, and would they have to be reevaluated on that CON before they get transferred, or how does that work?
They would be similarly situated to a patient that's at a psychiatric hospital. Once they no longer meet the legal criteria for involuntary admission, then they would have to be discharged from the hospital. If there were circumstances where that person continued to not meet criteria, and this would be the same whether we had this bill and had Section 2 or not had Section 2, they would still have to wait until there was an available place for the appropriate patient-payer relationship, all of those to determine that they can be treated in that facility. And they are not moved from the first facility, if they are in fact in a facility, unless there is availability. But again, if they don't meet legal criteria and they're kept at the first facility awaiting a bed, then once they no longer meet criteria, they would be discharged.
Okay.
Chairman Terry.
Thank you. And so that was what I was looking for. And so you said that the patient will be seen as soon as they get to the facility. I'm sure somebody that gets there is going to do H&P and work up on that. Why is that not, to Chairman's point, why is that person not signing the second, or why could they not say they're evaluated and, don't disagree or something along those lines? If they're going to be somebody there to take care of them, why isn't there somebody that can just sign that? Or
And they absolutely can, and I imagine that will continue to happen probably an overwhelming majority of the time in circumstances where potentially there is a one signature situation.
But not every time.
Permissively, potentially not every time. Yes, sir.
Okay. All right, thanks.
Thank you. Any further questions, comments? Representative Mitchell, you're recognized.
Yeah, and I'm like Representative Jernigan. You know, most of this bill is great. It's just that one section 2 scares the death out of me. You know, it's kind of like what he just said most of the time. Well, it's kind of like, you know, our judicial system, you know, I'd rather let how many guilty people free than to put one innocent person in jail. Well, same scenario here. You know, we're going to have someone committed, take away their freedom for up to 72 hours. Doesn't sound like very long, but until it's you. and then it's a long time. So, you know, that part of this bill scares me. I just think we need to, you know, as Darren said, there's got to be somebody at that facility who is assigned to be that second signature in this situation. And I think it's a great bill then.
Chairman Williams, you're recognized for the while we're still out of recess. We're still out of session.
Thank you, Zach. Just to follow up to the question, early in the discussion, we were talking about when someone presented to a mental health facility, they were getting a review. Then we moved to they were at a health facility and they were being reviewed there. If the concern from some of my colleagues is they're not being reviewed twice, I look at it as if something were to happen in my community. Typically what happens with a mental health patient in my community, they present to the hospital. They're evaluated at the hospital. A room is found for them at the end, hopefully within a week, which is very problematic. And then once they do find room at them in the end, for them in the end, they then go to that mental health facility of which they do get the second review upon arrival. Is that not the case?
Mr. Blair?
Thank you, Chairman. Yes, that absolutely would be the case.
So what I guess the reason why I'm clarifying that is it's not as if a patient is not getting reviewed at the medical facility and the mental health facility. That's meeting the two counselor threshold that I think that you're achieving to do it in that instance, which is where 90% of the people that end up in our mental health facilities present in ERs in our communities. It's only those who have had a history as it relates to mental health that would be in the 10%. So I think it's important for you to clarify for us that there are two reviews, and they're even when in this bill it stated as one review because a medical facility prior to the mental health facility has to have someone there that's looking for a bed with them and has evaluated that mental health patient.
Mr. Blair?
And Chairman, that is something, the only way I would envision where you would be, because I'm not aware of many acute care hospitals, emergency departments hiring psychiatrists. The only limited situation where I think this would apply is if an existing patient of a licensed psychiatrist showed up at that psychiatrist office in a crisis, then that process to find them a bed would begin after that first certificate is executed. But you're correct. They are evaluated, I would almost say, constantly as they hit the door of that inpatient psychiatric hospital for the purpose of determining whether or not they continue to meet criteria to stay there without further legal intervention and further certificates of need that are required for the commitment step that goes beyond what this bill is contemplating.
Thank you.
Chairman Jernigan, you're recognized.
Zach, am I hearing you say that 2 reviews is the same as 2 certificates?
Mr.
No,
Blair?
sir. No, sir, it's not.
Okay, then I'm back to where I was, so thank you so much.
Thank you. No further questions for the speaker. We are back in session.
Thank you, Chairman.
Thank you, Mr. Blair. Chairman Vaughn, we are back on your bill. Any further comments or any questions from committee members? Closing comments, Chairman Vaughn.
Thank you, Mr. Chairman. Thank you, committee, and thank you, Zach, for being here, the man on the spot with the answers. We live in an imperfect world. Sometimes we're searching for the best solution within this imperfect world that we live in. And that's what we're trying to do is get people care faster when we have the opportunity to do so. And with that, I would just ask for your support of the bill.
Thank you. You ready to vote? All those in favor of sending House Bill 469 to full health committee, please signify by saying aye. Aye. Any opposed, please say no.
No.
The ayes have it. If you wish to be recorded as no, please let Ms. Adams know. Your bill moves forward to full health committee. Thank you. Forgive me, I'll restate that. The bill was House Bill 1051. Forgive me, I misspoke. I was moving ahead. Once again, to restate, House Bill 1051 moves forward to full health committee. Forgive my mistake. Now we are going on to item number 4 on the calendar, which was the previously stated 469. Forgive me. The request has come from Chairman Crawford to roll this bill for 2 weeks. Without objection, House Bill 469 is rolled 2 weeks. We are now on item number 5 on our calendar. Chairman Dr. Kumar, I think this is House Bill 1311, 1311. Have you requested to roll that a couple of weeks, Chairman Kumar? And I know your next bill is up after that. Okay. The bill dealing with Graduate Physician Act is the one you'd like to roll 2 weeks?
Yes, sir.
Okay. Item number 5 on our calendar is House Bill 1311 by Chairman Kumar will be rolled 2 weeks without objection. Brings us to item number 6 on our calendar. A bill you will be recognized on is House Bill 1315 by Chairman Kumar. You are recognized.
Thank you, Mr. Chairman. I do have an amendment. It is 3597.
We have a motion. We have a second. Chairman has indicated there is an amendment that will make the bill coded drafting code 3597. We have a motion. We have a second on the amendment. We'll go ahead and get the amendment on the bill to get us in the proper posture for discussion. All those in favor of placing amendment number 1, coded 3597 on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. We are on your bill as amended. Chairman Kumar.
Thank you, Mr. Chairman and committee. Obesity is a major problem in our society. We are all aware of it. It affects adults and children. It's a complex, multifaceted condition, and in addition to the physical impairments that it causes, it also has serious diseases associated with it. The incidence of heart disease, stroke, diabetes, vascular disease is much more common as a consequence. It affects 1 in 5 children, and because of these problems and an initiative to do something about it was created by the legislature last year, Public Chapter 373, and we created a Chronic Weight Management Task Force. The task force consisted of 3 members from the House, 3 members from the Senate, and additional medical experts appointed by the speakers of each chamber. We met over the summer, and ultimately a final report was issued in January of this year. There are 8 recommendations, including enhancing what we can do as far as the Tennessee State Insurance Program about management of obesity. The 2 main recommendations that are embodied in this bill and this amendment are that 1, TennCare covers obesity medications or anti-obesity medications up to age 21. This bill asks that they be covered at all ages, the age restriction is removed. And secondly, a pharmacist collaborative practice agreement is established in which pharmacists working with physicians will be able to manage and dispense these medications, order the necessary tests, be able to interpret them, and manage the disease. This will add another aspect to management of obesity with medications, and we hope that this will create a better environment to be able to handle this difficult problem. With that, Mr. Chairman, I'd be happy to answer any questions.
Thank you, Chairman. Questions or comments for the sponsor? Chairman Terry, you're first, then Chairman Leatherwood after that. Chairman Terry, you're recognized.
Thank you, and thank you for bringing this piece of legislation. I guess the first section I think is good. The second section, I guess one of the concerns that I would have, and maybe you have more details on this, with all medicines, it seems like nowadays there's supply chain issues with that. Just tell me what your thoughts are on how that might impact those that are taking some of these medications for diabetes, and now if we add other members that would be potentially getting this medication, potentially driving up those costs or whatever. Just, you may have more information on this, so be happy to listen.
Chairman Kumar, you're recognized.
Are you concerned? The concern that I detect from you is about a relative shortage of medications considering this. Well, sincerely, I think will have to be judicious management of the medications, and we will do the best we can. I think management of supply chain per se is a national or international issue, affects all aspects of life, and I think it will affect that too. But at the same time, use of those medications for these patients is putting them in proper use.
Chairman Terry?
Thank you. I don't disagree with you. I do agree that a lot of it's being used off-label and trying to improve the lives of these individuals. The issue I think that ultimately may be on this is obviously going to be finance. So, but yeah, we're having supply chain issues with all sorts of medicines out there, whether it's anesthesia or antibiotics or whatever, and that's just a concern that I think that's going to be out there. But I do agree with you as far as it being an issue in the state, and helping individuals and letting physicians be able to treat patients as that are in these types of situations. So thank you.
Thank you.
Chairman Leatherwood, you're recognized.
That wasn't me.
It's time to take your Chairman Terry, it's time to take your medication, I believe is what it was. Chairman Leatherwood, you're recognized.
I can prescribe that to you, by the way. I've got a geology degree. So, I was wondering, you say it has been limited to age 21 or younger. I wonder why that is, and why would they do that, and why expand it now?
You recognize Chairman Kumar.
I would assume that there was the age limitation placed on use of these medications for TennCare members. And I think the fact is that there are very few members who are on TennCare beyond that age. So I think the numbers probably did not justify it. At this time, obviously, we would like to cover everybody who would benefit from these medications.
Representative Mitchell, you're recognized.
Yeah, thank you, Mr. Chairman. So Representative Kumar, Dr. Kumar, this is more or less your bill is giving them access to Wegovy for the most part.
Chairman Kumar.
That's one of the medications. No, there are other options too.
Yeah, but I mean, the shortage is the Ozempic, Wegovy shortage, same medication, correct, doctor? Ozempic costs $950, but if somebody needs Wegovy to lose weight, they charge you $1,400 for the same medication. Is that correct, doctor?
Chairman Kumar.
I have not priced them, but
yeah. So again, it's another you know, pharmaceutical industry problem we're going to have here, and it's going to, I'm sure your note is quite large on this to get it passed. So, I mean, that's just something else everyone needs to understand. It's the same medication. They're just charging $550 more for it. But I just wanted to bring that to the committee's attention. Thanks.
Thank you. Chairman Kumar.
I would just like to note that 10K rates and contracts are likely to be at a different level.
All right, any further questions or comments for the sponsor? Seeing none, are you ready to vote? We are voting on House Bill 1315. And the vote will be to go to full health committee. All those in favor to send House Bill 1315 to full committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you.
Thank you, Chairman Kumar. We are now on item number 7 on our calendars, House Bill 729 by the vocally eloquent Chairman Bud Hulsey. Chairman Hulsey, you're recognized on House Bill 729. Do we have a motion? We have a motion. We have a second. You're recognized.
Thank you, Dr. Hawk. I appreciate that very much. This bill is pretty simple. There's a group of folks in their clinic. If I can get my words out, that's real eloquent, isn't it? This bill allows pathologists to perform swallowing tests without a doctor in an outpatient setting. Now, they already do this, called FEES. It's a flexible endoscopic evaluation of swallowing. And these folks already do this without a doctor there at nursing homes and rehab places like that. And so this allows them to do it in their clinic setting while they still maintain contact with a doctor in case something goes wrong or they have an emergency. And I have somebody from a clinic actually in my district who would like to speak on this, if you'll allow that.
Okay. I think we will. We'll go into recess to hear from Brittany Rushing. If you'll please come forward. Thank you, Ms. Rushing. We'll just make sure that the microphone is on, and we will go in recess. Ms. Rushing, Dr. Rushing?
Just Brittany Rushing.
Brittany?
Yes.
You are recognized.
Thank you. I appreciate the opportunity to be able to come forward and speak with you all today. I am a speech pathologist in East Tennessee. I am FEES certified, which means I can do endoscopy in the state of Tennessee. And as Mr. Hulsey already described to you all, we complete these assessments in nursing homes and rehab centers without direct physician supervision at this time. But we are limited. We are unable to do that in the outpatient setting due to the Tennessee law. And so we are governed in our country by ASHA, the American Speech Language Hearing Association, and they do not have a guideline that says a physician has to be on site. That is Tennessee law, and we are one of the few states who has that law placed on us as endoscopists. So we come forward just to see if you all would consider amending this law. We do know that the risk of performing a FEES, we stay above the vocal cords, it's less than 1%. And so those risk factors are a potential nosebleed, a vasovagal response, which would be fainting, a laryngospasm. But as I mentioned, we're staying above the vocal cords. And so there was a study published. They looked at 6,000 patients, and the risk of anything happening was less than 1%. Our clinic has done 213 FEES exams, and we have had 0 adverse reactions up to this point, and that's in the nursing homes and rehab centers. Do you all have any questions for me?
Chairman Terry, you're recognized.
Thank you, and appreciate you coming here today. My daughter has apraxia, and she goes to speech-language pathologist, and so I'm very well of all that. And I just, you brought something out. That was one of the questions that I had as far as laryngospasm, and just it'd be a slight risk, but as far as your process that you go through, are you numbing things up? Or what's the process that you're allowed to do when you do these endoscopies?
Ms. Rushing, you recognized.
Sure. We actually use no topical anesthesia. We place the endoscope into the nair, and if we need to use a lubricant, we will use that. The patient is not sedated. They're awake the whole time. They're interacting with us. And so if there was any potential risk factor, like if they started to feel faint, our first response obviously would be to remove the scope. Like I mentioned, we're above the vocal cords, and so in the 6,000 study, there is a known risk that there can be a laryngospasm, but they never actually saw it in the study.
Chairman Terry.
Thank you. You just have them phonate while
yes, it's
I'm
actually
just fascinated. Just
yeah. Oh, sure.
y'all go on. We're having a conversation here.
It's actually a swallowing test. So we put food coloring in different consistencies of foods, liquids, all the way up to solids. And we're watching to see if the patient aspirates the food or liquid. And also if they have a problem with efficiency, like if the food bolus doesn't move through the throat well. We're also able, we're trained to look for any potential lesions, and then we can make that recommendation to send the patient over to ear, nose, and throat, or maybe GI if that's an appropriate recommendation. But we stay in our lane with looking at swallow physiology.
Chairman Terry.
One last question that nobody else in here cares about. So y'all have this on a screen, or are you looking through the scope, or?
Yes,
Be able to take pictures and stuff, videos.
Yes, our scopes have cameras on the tip, and it's all hooked into a mobile unit with a computer, and so we're watching on a screen and we record it, and then we have digital images at the end.
All right, thanks everybody here for indulging me.
As I said earlier, I love it when the smart people talk to each other. This is great. Any further questions or comments for Ms. Rushing while we're out of session? Ms. Rushing, thank you very much. We're back in session.
Thank you.
As we were talking about smart people, here comes Chairman Hulsey again. Chairman Hulsey, you're recognized on the bill.
Thank you, sir. I just was going to point out one other thing. The bill does call for a protocol to be able to establish contact with a doctor if they need it. So,
okay, thank you very much. Any questions of the sponsor? Ready to vote? Questions called. All those in favor of sending House Bill 729 to full health committee, please signify by saying aye. Aye. Any opposed, please say no. House Bill 729 moves forward to full health.
Thank you, committee and chairman.
Thank you, Chairman. I think the request on the next bill, item number 8, Chairman Hulsey, is to roll for 1 week. Is that correct? Ladies and gentlemen, item number 8 on your calendar, House Bill 966 by Chairman Hulsey, is rolled 1 week. Without objection, will be rolled 1 week. We are now on House Bill, item number 9, House Bill 667 by Chairman Hicks. Chairman Hicks, you are recognized, sir. We have a motion. We have a second. You're recognized, sir.
I wish to roll this for 1 week, Chairman. Thank you.
Thank you. The request has been to roll House Bill 667 for 1 week without objection. The bill is rolled 1 week. Thank you. All right, ladies and gentlemen, we are now on item number 10 on our calendars, House Bill 283 by Chairman Baum. There's Chairman Baum. Chairman Baum, you are recognized. You have a motion and a second. You are recognized, sir.
Thank you, Chairman Hawk. Currently in Tennessee Code, hospitals are required to offer a flu vaccine and a pneumonia vaccine for patients who are age 65 and older between the months of October the 1st and March the 1st. This is a bill that would expand that so that a hospital would be required to offer a flu vaccine to patients during those months who are age 50 and older. It would lower the age requirement from 65 to 50. It would also require hospitals to offer the pneumonia vaccine to the 65-year-olds and over year-round instead of just the October the 1st to March the 1st period. and these are recommendations that have been provided by the CDC.
You've heard the explanation. Any questions or comments for the sponsor? You ready to vote? All those in favor of sending House Bill 283 to full Health Committee, please signify by saying aye. Aye. Any opposed, please say no. House Bill 283 moves to full Health Committee.
Thank you all.
Thank you, Chairman Baum. We are now going to item number 11 on the calendars. I think Chairman Reagan had to be in another committee. Oh, there he is. We've taken enough time to get to where Chairman Reagan was through in his other committees. Yes, thank you. Thank you. Chairman Reagan, you're recognized on House Bill 1380. Do you have a motion? We have a motion. We have a second. You are recognized. I think we were talking potential amendatory language, sir.
You are correct, sir.
Yes.
However, I have some extremely bad news.
Yes,
Legal
sir.
has not got my amendment back to me in time.
Okay.
So I'm going to have to ask to roll this for 2 weeks.
Okay. At the request of the sponsor, we will roll House Bill 1380 for 2 weeks. Is that your request, sir?
Yes, sir.
Forgive me. Chairman Williams, before we take action, Chairman Williams,
Yes.
you're recognized.
Thank you. Just a quick question here. Earlier today, parliamentary, we've rolled 2 bills, 2 weeks. I didn't know if the chairman had made a last calendar yet, or announced a last calendar yet. I just didn't know if we're rolling into last calendar or whether we should say last calendar in case Chairman Reagan comes back on his 3rd hearing, because this is his 2nd hearing.
Your point is very well taken, Chairman Williams. Thank you very much. We still have well into double digits in terms of number of bills to discuss in this subcommittee. So I do not envision 2 weeks from today being our last calendar. I believe that we will still have another calendar post 2 weeks. Is that, and Chairman Williams, I'll help me where your thought process is going, sir.
Well, you're the dean, Chairman, but I will say the concern was if we rolled 2 weeks and it was possibly only a 1 week variant between the two, it might behoove us to the motion to be last calendar. That would give him more time to get his mandatory language together, and whenever we do have a last calendar, then if something unforeseen happened, he wasn't able to get his amendment, he's on that calendar and not the other. So I'll leave it up to the chairman and the chairman to determine which is best.
Mr. Chairman,
Certainly.
if there's a problem, I can take the bill off notice and put it back on.
And that was what we discussed at this level. I understand the rationale, Chairman Williams, and I'm whichever way the sponsor feels comfortable going. I'm comfortable going toward the last calendar, or I'm comfortable going 2 weeks. And if as you stated, you felt you needed to take it off notice, we can do that as well.
Well, our legal section, as everyone in here is aware, is snowed under because there's a lot of bills getting amendments, and this particular amendment has some significant changes to it. So it's going through their process perhaps a little more slowly than some others. That said, I will go ahead, if the chair is amenable to this, and in deference to Chairman Williams there, take it off notice and put it back on when I've got the amendment.
Okay. I'll tell you what, just so we're the committee is understanding, we were going to work off drafting code 4409 was what we were going to be working on today. Chairman Reagan, in your discussion about a potential different amendment, is it language different from 4409?
Yes, sir, it is.
Okay, I understand perfectly. I'm going to entertain the request will be to take the bill off notice.
Thank you.
And then we will at Chairman Williams' suggestion allow you to put the bill back notice on notice as you receive the mandatory language. So
thank you. And Mr. Chair, if I could, let me make sure that I make it very clear.
Yes, sir.
No dispersions cast toward legal. Like I said, they are snowed under right now, and when they get a complicated change, it takes a while. So I apologize to the committee, but as fast as we can go.
Thank you. Thank you, Chairman Reagan. And House Bill 1380 is off notice.
Thank you.
Without objection. And I'll echo the comments from Chairman Reagan as well. Our legal staff is working tremendously hard. As I look back at Ms. Campbell behind us, who is filling in and working the desk back here with us, as well as Caroline. So I want to thank you personally for all the work that you all do for our legal staff. Thank you very much. We are now moving on to item number 12 on our calendar, House Bill 242. Again, Chairman Williams, the bill, House Bill 242, the request has been to roll for 2 weeks. So the request by the sponsor, Representative Hale, House Bill 242 will be rolled 2 weeks without objection. That leads us to item number 13 on our calendar, House Bill 305. The request has come to our office as well for this bill to be rolled 1 week. I'm going to check with my folks to be sure. That is accurate. The request has been to roll House Bill 305 by Representative Jones for 1 week without objection. Bill is rolled 1 week. We are now on item number 14 on your calendar, House Bill 325 by Chairman Terry.
Thank you. Oh, I'm working with the Department of Health on this for a potential amendment, and they have asked me to roll this 2 weeks.
All right. We're being very consistent here. All right. The request from Chairman Terry on House Bill 325 is to roll that bill for 2 weeks without objection. Ladies and gentlemen, have we... All right, ladies and gentlemen, we have been very efficient with our time. Thank you so much for the time that you've put toward this committee. Members of the committee, thank you so much. With no objection, we are adjourned.